This is Nana coming to you this evening for the purpose of talking to you about heart attacks. Give a little background here. I taught nursing school, and we used to teach that the symptoms of a heart attack were heavy weight on your chest, sweating, nausea, those kind of things. Well, to my memory and understanding, those symptoms came from white men. That's who they surveyed. Well, come to find out, women have different symptoms for heart disease. I spent this one summer that every time I put something on my purse, a heavy purse on my left shoulder, it would get achy. So I decided that, oh yeah, I can fix this. This is just, I'm straining that side. So I'd start wearing my purse on the right side. And then I noticed when I came home from work, I'd sit on the couch sometimes and I'd just fall asleep, sitting up. Another thing that happened to me was my left jaw started bothering me off and on. I went to the dentist, they did x-rays, they couldn't find anything. So there were some symptoms that I was having that I ascribed to other things besides having anything to do with heart disease. Well, one morning I woke up and my left arm was sound asleep. And you know how we all do that. We fall asleep on our arm and we just pick it up and it comes back. Okay, well, and that happened to me that day. So I went on to work, and while I was at work, folks around me began to notice that my lips were blue, and what I knew was I was so tired. I just could hardly make one step from the next. I felt like I could go to sleep standing up. I ended up going into the emergency room where I had cardiac arrest. Now, I've just told you the only symptoms I had was tingling, a little bit of pain right here in my arm. And to describe the pain, to be like where they take your blood pressure, and that's what it feels like. And my jaw hurting. I did never go through, to this day, I've never felt like something was heavy sitting on my chest. Didn't feel like that at all. I arrested. I ended up getting 2 stents. I ended up being in ICU with some complications, and the complications were the first time I got out of bed after a cardiac cath. It was about 6 hours later, but I passed out, and therefore that led to some ICU time. Well, I was single. My dad came in, picked me up from the hospital, took me to my home, and I needed some prescriptions, obviously. And so he took my credit card and he went to the local pharmacy and he got those prescriptions for me. And a can of soup was set out for me, and a manual can opener, and a pot to cook it in. And then he and his wife left. I want to tell you what my feelings were then. Scared to death. Home by myself. Not sure who to call. Didn't matter how many years as I had as a nurse. I was afraid. Well, different friends started calling me, wanting to come get me, to take me for a ride, whatever, and bring food to my house. And I had to be off work for 2 weeks, and it was at a holiday time, so that worked out pretty good. That was good for me. Well, I got 2 stents in my right coronary artery. Well, and got put on some medications. Well, about 12 years later, 12 years, I'm still right about the size that I am now. I'm moderately exercising. I have never in my life done street drugs. I've never smoked. I didn't fit the categories of what I should have fit to have cardiac disease, but I did. Well, Buddy and I went hiking in Helen, Georgia, and I couldn't make that little bit of elevation. I just got so short of breath. And then I thought back to how many times I'd been at homes that we'd go up the stairs and I couldn't do it. the blood pressure cuff feeling came back, the jaw feeling came back, and had a series of episodes, I would say, to where my arm was just going to sleep, fingers tingling, and went into the hospital and had a triple bypass. Kind of young for a triple bypass at that point in life. Uh, and I think some of the worst patients are people who have been in medical professions for a long time, because we see and we listen and we hear different things than not only what we've been accustomed to, but what we were trained for. I laid in the ICU bed and I listened to travel nurses who couldn't find 4x4s, or who were asking where syringes were, or you get my point. In addition to that, in that time in the hospital, Buddy and I, just in casual conversation, learned that the largest majority of the nurses who were taking care of me in the hospital were, they had gotten all their patient care training on Zoom during the flu/COVID time. That was also disconcerting to me. I, you know, I had taught anatomy physiology. I had taught the anatomy of the heart. I had not taught the diseases of the heart. So what I knew was what I had heard from general public, or way back when I was in nursing school many, many years before. And the open heart surgery, you know, I complained about 30 days later at my follow-up visit to my surgeon, and I said to him, I'm still weak. I'm still short of breath. I'm still in so much pain. I know everybody's not like that. I realize that they're not. I was. The vein that they took out of my left leg, I had stitches and was swollen all the way from my ankle to my groin. And it by the time I got home from the hospital, my leg was twice as big as it should have been. And it hurt. In addition to my chest, it hurt. The scar was all the way from right here, 12 or 14 inches down, long way. And it was irritable, is the best way not to put it. And the reason that I tell you this is this. The surgeon said to me, dear, you had your heart taken out. I cut open your chest. I used a saw to separate your chest bones. I cut ligaments, I cut tendons, I cut blood vessels. I physically took your heart and had it in my hand. Nothing was connected to it. And then I put all that back together with that vein in your leg. He said, what part of that do you think is not going to hurt for a good while? Well, of course, I felt like an idiot and a big complainer, just a wuss. But the short of it was, I saw a difference in my life after that. One of the things I saw that truly, truly, permanently humbled me was having a partner that really loved you, that would help you put on your pants, because you were told not to put your pants on yourself, because you just couldn't take any chances of undoing anything that was done in your chest. A partner who had to get the milk out or the drink out for me every time because I couldn't hold anything heavy. A partner who, every time we got in the car, like to go for a doctor's visit for a month, I had to sit in the back seat. He had to put a pillow across my chest. I had to put the seatbelt on top of that because of this thought that sitting in the front seat, if somebody hit us and the airbag went off, well, I'd be gone. I'd be a goner after that. My diet changed. It was difficult to have enough energy to eat a whole lot for a good period of time. The person that you choose for your life better be somebody who's there for you. Better be somebody there. Somebody that's there for you. And he was. And it was hard on him. The few weeks during that time frame, I was in the hospital, I think 11 days. I was gone to surgery for 8 hours. that stress was so hard on him. I saw him walk by with a basket of clothes going to the laundry after I was home, going to our laundry room, and I thought, oh my, he doesn't know how to wash clothes. You know, he doesn't know how to cook a meal, to put things together. Well, my friends here brought meals over to me. One friend came in the middle of the night when it was impossible for me to get up to go to the bathroom, and that friend came and helped Buddy get me to walk around some. I was supposed to walk for about every 3 hours to prevent blood clots, and I used a walker for a good while, and then I used a cane. And then if we went somewhere, I got in the wheelchair or that little motorized things that they have at some of the grocery stores. I'm trying to share with you that a few things. One, in closing, heart disease in women is different. Heart attacks in women is different. Heart surgery in women is different than it is what you read for men. That's the first thing. The second thing is prepare for it to change your life. Things taste different. You're taking a ton of pills. I came home from the hospital with the heart surgery, close to 20 new medicines to take. All the ones from healing the scar to the stitches to my leg to the pills to regulate my blood pressure, the things to keep clots from forming. I mean, I was in a brand new world, and when you go into taking that many pills, you are different. I responded to my caretaker differently. Another thing that I want to say is do something my surgeon said, give yourself some grace. Give yourself some time to recognize that you've had life-changing experience and that you're not going to go back to the normal that you had before. And it's up to you. It's up to you to eat right, to stay active, to take your medicines, to eventually maybe get rid of some of those medicines, which I did. I'm fortunate to have a good general practitioner now that has worked with me to get rid of some of those medicines. So, loves you enough to take care of you. Invest the energy in that person beforehand. Have somebody who wants to learn, who truly loves and cares about you, around you, because it's going to take a while. And pay attention to your doctor, your general practitioner, your cardiologist on how you should go forth in life after heart attack and heart surgery. Part of my life is spiritual, and who I rely upon is first God and second my husband, and everything else comes way below that. I value the relationship that I have with God. I value the relationship and love and respect I have for my husband even more after the heart surgery. Not every man is going to help you get up and down for a few weeks, because you're not supposed to push yourself off the couch. You're not supposed to reach for certain things. You're not supposed to pick up certain weights. You're just like a baby being taken care of, and that takes a lot when you don't have somebody there to help you do that. So I like the word heart because it's not just the heart surgery. That's my heart. That's where my bypasses were. My surgeon drew that on there. I keep this as a reminder to stay busy, keep loving, learn how to receive love, because sometimes I think we're guilty of that too. But more importantly, to shout out to women that you will have different symptoms, and not just what the textbook says, and that you have to take care of yourself. And so that's what I wanted to share with you this evening. It's a pretty big deal to have this. Pretty a major deal. I saw a study yesterday from anesthesiologists around the country, and they listed that the most difficult procedures for them to anesthetize is two. Number one is a liver transplant. Number two is what I had. And I'm grateful, I'm thankful, I'm here because of the love and care and the guidance that I got from my spouse, my husband, my best friend, and from the medical professionals in my life. I just wanted you guys to know that that's where I am. Thank you for watching and caring. Please like if you like this video. Let me know what you think about it. This is a pretty big deal. If you got somebody in your life that's having this kind of surgery, stay close. Give them, take care of needs that they may not know that they have. And treasure each other. Life is pretty doggone short. Thanks.